As an ancient civilization with a 5,000-year-old history, the sheer vastness and diversity of India challenges human imagination. With over 1.2 billion people, India is home to 1/6 of the world's population. Most states in India have populations larger than entire countries elsewhere in the world. The state of Uttar Pradesh alone has a population of 183 million, which is almost the same as Brazil and more than half the population of the United States. Today, India is hailed as one of the fastest growing economies in the world. With a GDP growth of 8.6%, the sturdy economy has been able to withstand the recent global recession effectively. As many as 8 of the top Fortune 500 companies are from India. More than 40% of our population consists of youth below 25 years, indicating tremendous human resource potential. And yet, India is not free from challenges. As the world's second largest democracy, the country spreads across 28 states and 625 districts. With 6 major religions, 18 spoken languages, and over 2,000 ethnic groups, socio-cultural changes are seen every 100 kilometers or so. As a result, formulating and executing strategies for improving the lives of people here is a daunting task. Despite India's impressive economic growth, it still contains the largest concentration of poor in the world. Almost half of India's population falls below the international poverty line of $1.25 a day. Over the past 2 decades, huge investments in tertiary healthcare have led to a fast-growing private health system with state-of-the-art facilities. However, the main burden of health service delivery is borne by the mammoth public health infrastructure that reaches the remotest parts of the country. Yet, 60% of the poor spend most of their earnings on private healthcare, further intensifying the cycle of poverty. Against this challenging backdrop, FHI began operations in India in the early 90s. Globally, FHI's mission has been to improve the lives of the world's most vulnerable people in lasting ways. In 1997, FHI received its first funding for India from USAID for technical assistance to the National AIDS Control Program. Today, FHI manages a portfolio of 10 large-scale projects in India, spanning across technical assistance, program implementation and research on HIV AIDS, family planning and health system strengthening. The annual turnover of FHI in India has grown rapidly from $0.5 million in 1997 to $20 million in 2010. Among others, FHI's flagship programs on HIV AIDS in India include Astha in Maharashtra, Bala Sahyog in Andhra Pradesh and Samarth. Mumbai, the commercial capital of India, is a city of glaring contrasts. The city is home to Bollywood as well as the largest sex industry in Asia. It is here that FHI implements the Aastha project. Funded by the Bill and Melinda Gates Foundation since 2004, the project has reached more than 75,000 sex workers and their partners in Mumbai and Thane districts of Maharashtra. Covering a range of typologies of sex workers, the project promotes HIV prevention, care and support through strategic behavioral communication, condom provision and STI clinical services.
आस्था से जुड़ने के बाद तो पूरी ज़िंदगी बदल गई। सबसे पहले तो अपनी एक खुद की एक पहचान मिल गई मुझे। मतलब जैसे कि मैं सोचती थी कि जैसे मैं एक अकेली हूँ जो ऐसा काम कर रही है, एरिया में जा रही हूँ, और दिल में मन में एक डर सा था, वो डर मेरा सबसे पहले तो ख़त्म हो गया।
तो वहाँ देखा, मैं जब आया तो अच्छा ऑफिस था। पहली बार ज़िंदगी में ऐसे लगा कि मैं कहीं अच्छी जगह जाकर ऑफिस में बैठा हूँ, नहीं तो फुटपाथ के अलावा कुछ देखा नहीं था।
आस्था से जोड़ने के बाद मुझे और एक चीज़ मुझे मिला, जो मैं पैसे के लालच में हमेशा कस्टमर के साथ बिना कॉन्डम से सेक्स करता था, लेकिन राइट नाउ मैं खुद कॉन्डम इस्तेमाल करता हूँ।
जब आस्था के साथ जुड़ा हुआ तभी हमको पता चला, अरे PL HIV के साथ जो पॉजिटिव लोगों के साथ हम लोग खाते पीते, उनके साथ रहना उठना, उनके साथ बैठ उठ के खाना था, उससे कुछ भी नहीं होता। ये आगे एक बदलाव आया मेरे अंदर।
उनका काउंसलिंग करते करते मैं खुद भी सुधर गई। जैसे कि मैं भी अपने पार्टनर को क्लिनिक तक नहीं लाती थी, फिर मैं भी अभी हर महीने क्लिनिक में लाती हूँ।
अपना कपड़ा लत्ता पहनने का तरीका, एक बैग लिए नहीं थे, कभी बैग लेके चलना आ गया, सब कुछ आ गया।
With the aim of strengthening capacities for an effective response to HIV AIDS in India, FHI is implementing the Samarth project, funded by USAID since 2006. At a macro level, the Samarth initiative extends technical assistance to the National AIDS Control Organization NACO. Samarth also supports demonstration projects for HIV-infected and vulnerable children in Delhi as learning sites. One of the projects implemented by Salam Balak Trust is on HIV prevention among runaway and street children. These boys and girls are rescued from railway stations, bus stands or streets and provided short-term shelter, repatriation and rehabilitation support through young peer educators. At the centre, the children have access to medical services, vocational training, enhancement of psychosocial skills and sensitive counselling. This protective and productive environment ensures that children are not subjected to sexual or physical abuse. Another demonstration project under Samarth is with WAG Chelsea, which addresses HIV care and treatment needs of young children living with HIV in urban slums of Delhi. Using community mobilization and outreach, home visits are conducted to equip infected and affected family members take care of themselves. Life skills education sessions ensure that the children are empowered to protect themselves in all spheres of life. One of the landmark achievements of the project has been addressing malnourishment among the HIV-infected children through close growth monitoring and appropriate nutrition supplementation. All along, FHI has endeavoured to work towards bringing about a lasting improvement in the lives of the most vulnerable segments of society.
जैसे हम पे बीती है, हम ये सोचते हैं कि और कोई दीदी पे ना बीते और कोई लड़की पे ना बीते। वो बोलती कि हाँ मेरे घर की कंडीशन खराब है, मुझे लग रहा था कि मैं आऊँ और इसमें ज़्यादा पैसा है, वो उसकी मर्जी। लेकिन कोई हमारे जैसे, हमारी बहुत कम उम्र थी जब हम शुरुआत कर रहे थे कि एक 50 साल का था वो, उसके साथ हमको एक रूम में छोड़ दिया। हम जब उसको देखे तो हमारे जो अंदर की जितनी तमन्ना थी, हम कभी कभी किसी औरत को या कोई बच्चे को देख के सोचते थे कि हमारी भी फैमिली ऐसी रहेगी, हमारा भी घरदार ऐसा रहेगा, हमारा भी पति ऐसा रहेगा। वो जब 50 साल के बुढ़े को देख के हमारी पूरी तमन्ना दब हो गई थी उस दिन। तो हम ये सोचते कि कोई भी लड़की का ऐसी तमन्ना दब नहीं होना चाहिए। हम पूरी तरीके से उनको साथ देंगे। ये बात बोलती हूँ, जितना मेरे से होगा ना, मैं एक भी मेरी दीदी को किसी का शिकार नहीं होने दूंगी। उसकी इच्छा है तो ही हो जाएगी, कोई उसको जबरदस्ती नहीं करेगा।
Today the future holds great promise, for the FHI mission is now being carried forward by the community itself.